Hello friends, today we are going to discuss about autism. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about autism, how the diagnosis of autism is made, the prevalence and comorbidity seen with autism. The word autism was first used by a psychiatrist named Eugene Bleuler in 1908. The autism is a Greek word that means self. The word autism was coined from there. The Bleuler observed certain patients with schizophrenia having morbid self-admiration and completely withdrawn within self. That means they are lost in their own world. Till 1943, there was no much progress. But Leo Kanner, a psychiatrist, published a paper describing children whose condition differed so markedly and unique, which were never reported before. He studied 11 children who had difficulties in social interaction, difficulties in adapting to new changes in the life. They are unable to be flexible in routine changes, highly sensitive to stimuli, allergic to food. They had good IQ, but they had echolalia and difficulties in spontaneous activity. At the same time, another psychiatrist in 1944, Hans Asperger, working separately, also described the similar observation which was made by Leo Kanner. And in 1945, the Bruno Bettelheim was also studying the effect of autism and how it was manifesting. He did certain therapies and he came to a conclusion that autism occurred because of the refrigerator mother. That means mother is very cold. He also said that if both the parents are cold, definitely they are going to have an autistic child. That means if the parents did not show any warmth or emotions towards the child reflected the emotions of the parents. That means it's cold. Hence, the refrigerator mother and refrigerator parent was depicted. Because of this hypothesis, he advised parentectomy. That means remove the child from the parents. And hence, these children were institutionalized. They were admitted to the hostel, institutions, mental hospitals, various boarding schools. And this parentectomy became the norm at that time. However, the Bernard Rimland was a psychologist who had his own child who was suffering from autism. He disagreed with the Bernard's observation and hypothesis. Bernard attacked the theory of this refrigerator mother. He published his famous book called as Infantile Autism, the Syndrome and its Implication for a Neural Theory of Behavior. This heralded the search of biological theories for autism. Now, this autism has moved from DSM 4 to 5. In DSM 5, it is considered as autism as an autism spectrum disorder. Here, this autism is subsumed under the autism spectrum disorder, where Asperger's, autism, pervasive developmental disorder into a single diagnosis. And they have changed this pervasive developmental disorder into autism spectrum disorder, my dear friends. Now, the DSM 5 no longer provides differing criteria for each condition. In DSM 5, it has moved into a single basket, so-called autism spectrum disorder. A single set of criteria with several specifiers allowing the clinician to indicate the presence of certain features in autism spectrum concept. Further, to rate the severity of the symptoms has been clearly indicated under DSM 5. This moved into a dimensionality spectrum, my dear friends. Let's understand autism spectrum disorder. It is a neurodevelopmental disorder, but however, some of them feel it is a neurodevelopmental condition. It has impaired communication, social interaction, and rigid, repetitive behaviors are noted. Further, it is usually diagnosed between the age of 3 to 6 years. Boys are 4 times likely to be affected than girls. 1% of the population are known to suffer from autism spectrum disorder, my dear friends. Here, this is the triad of autism spectrum disorder. The triad consisting of impairment in social communication, social interaction, and repetitive behavior. That is autism spectrum disorder, my dear friends. Here, the autism is not a categorical yes or no. It is a spectrum. Spectrum of less spectrum autistic versus more autistic. That means the patient has fewer symptoms versus moderate symptoms versus more symptoms. That means it is a spectrum, my dear friends. As you see in this diagram, depending upon the motor skills, sensory skills, perception, language, and executive functioning, as the patient grows or the brain develops, these areas will also develop. That means autism spectrum disorder is not static, it is a dynamic in nature. The way the environment interacts with the person with autism, the person also improves. So, here saying that the person has autism, does not have autism, is a matter of diagnosis. But in reality, it is a spectrum, my dear friend. Spectrum, that is, bouquet of symptoms, disabilities seen across various impairments. Let's understand the diagnosis of autism under DSM V. Under DSM V, it is called as autism spectrum disorder. Here, they have a persistent deficit in social communication and social interaction across multiple contexts that is manifested by following or currently or in the history. That means they need to have either now or in the past. They have deficit in social emotional reciprocity. That means they are unable to reciprocally reflect their emotions whenever they meet the people. They have ranging, for example, abnormal social approach, failure of normal back and forth conversation, reduced sharing of interest, emotions, or affect. Failure to initiate or respond for social interaction is classically seen. Invariably, many researchers, clinicians feel that the deficit in emotional reciprocity is the pathognomonic of autism or autism spectrum disorder. Further, they also have deficit in nonverbal communicative behavior, which are used in social interaction, that ranging, for example, poorly integrated verbal and nonverbal communication, abnormalities in eye contact and body language, deficit in understanding and use of gesture, to a total lack of facial expression and nonverbal communication. The third important is deficit in developing, maintaining, understanding relationships, ranging, for example, from difficulties in adjusting behavior to suit various social context, to difficulties in sharing imaginative play or making friends, to absence of interest in peers is classically seen. Further, restricted repetitive patterns of behavior, interest, or activities as manifested by at least two of the following, which should be currently or in the past. These repetitive behaviors may be stereotyped or repetitive motor movements, use of objects or speech. Examples: simple motor types or stereotypies, lining up of toys, flipping of objects, echolalia, or idiosyncratic use of phrases are noted. Sometimes, insistence of sameness, inflexible adherence to routine, ritualized pattern of verbal and non-verbal behavior. Example: extreme distress to small changes in the routine, difficulties with transition in life, rigid thinking pattern, greeting rituals, need to take same route or eat same food every day. They are highly restricted, fixed interest that are abnormal in intensity or focus, strong attachment or preoccupation with unusual objects, excessively circumscribed or pervasive interest, or these are the classically seen in autism, my dear friends. Sometimes they have hyper or hyperreactivity to sensory inputs or unusual interest in sensory aspects of the environment. Example, apparent indifference to pain, temperature, adverse response to specific sounds or texture, excessive smelling or touching some objects, visual fascination with lights or movement. Here the severity is based on social communication, impairments and restricted repetitive patterns of behavior are classically noted in autism spectrum disorder. Here again, this autism spectrum disorder are three functional level has been divided. One is ASD level 1, ASD level 2 and 3. Autism spectrum disorder level 1 functionality means requiring support. The ASD level 2 is requiring substantial support. ASD level 3 means requiring very substantial support. Here, these revolves around social interaction, repetitive behavior, and also planning and organization of daily routine. Let's understand the level 1. Here, they require little support. That is difficulty in initiating social interaction, problem with planning and organization at times. They will have very little repetitive behavior or rigid behavior. Level 2 requires substantial support. Here, social interactions are limited, narrow special interest, frequent restrictive and repetitive behaviors are seen. The third one is severe deficit with verbal and nonverbal communication, narrowly focused and greater distress when changing behavior or focus is noted. Let's understand this specifier. The specifier under autism spectrum disorder is with or without accompanying intellectual disability or impairment, that is, mental retardation, with or without accompanying language impairment, associated with known specific medical or genetic condition, associated with another neurodevelopmental disorder or behavioral disorder, and finally, with or without catatonia. Let's summarize the understanding of autism spectrum disorder. Here, they have difficulty in social reciprocity, difficulty in social communication and social interaction, different social initiation and response are seen, different use of nonverbal communications are noted, difficulty with social relationship, social awareness, and insight. They have a restricted repetitive behaviors, interest, and activities. Fixed interest are noted. Different speech, movements, or play are noted. Rituals, resistance to change is a classic hallmark. And also, the sensory behaviors are also noted. Here, how the autism spectrum disorder have been divided under DSM V. In under autism spectrum disorder, here the classical autism, child disintegrative disorder, Asperger's syndrome, and pervasive developmental disorder (NOS) has been considered. Further, there is a social communication disorder and Rett syndrome also being classified. Let's understand the presentation of autism. That is, the signs and symptoms of autism. Although autism is very difficult to identify before 24 months, the first symptom often arises between the age of 12 to 18 months. The mean age of diagnosis of autism is between the age of 4 and 5 years. The early signs of autism in children involve absence of normal behavior rather than having abnormal behavior, my dear friends. In some cases, the earliest symptoms, which can be seen or even be misinterpreted as a sign of good baby, since the autism child will be very silent, quiet, independent, and undemanding. Absence of abnormal behavior will be striking in autism. That means it is the absence of normal behavior. What are those? The normal behavior which are supposed to be there in a child which is 1 to 4 years, that is, absence of response to when the child's name is called. But however, the hearing is normal. Limited use of gestures in communication, lack of imaginative play in the child avoids eye contact, do not show any facial expression of emotions, rarely shares enjoyment with the caregivers, do not share any interest with others, do little or no imitation with people, the child does not point whenever it wants something. The child also have unusual relationship with certain toys, use of repetitive words and phrases are noted, stereotypic behavior, moves fingers and hands and body in an unusual way, that is, repetitive behavior, which are fixed and rigid, shows excessive interest in certain areas, objects, also in the environment. Strong and unusual reaction to sensory stimuli is a classical of autism, my dear friends. So let's understand by this diagram, my dear friends. The child in the early signs which can be noted is there will be no babbling or cooing, which is noted in the autism child. Eye contact will be missing. Further, the child does not follow any object by eyes. That is, no eye following with regard to any bright light or object seen. Difficulty in mixing with others is a classical symptom. Spinning objects, playing with the toys unusually is seen or noted. The child hates whenever somebody touches the child. The child does not have any smile. There will be a classical absence of smile whenever the mother smiles. Inappropriate laughter and gigglings are noted in children with autism. Echolalia, and also by the age of 1.5 years, there will be hardly few words spoken by the child. But however, when the child is left alone, it will be talking to itself with complex words. At the same time, the child will have difficulty in language. The classical hallmark is emotional reciprocity is absence, social communication impairment, repetitive rigid behaviors is a classical presentation of autism. Further, many of the child with autism will have developmental learning delays are noted, difficulty in communication, difficulty in social situation, attachment to unusual interest or objects, toys, difficulty in understanding emotions of self and others, undersensitivity or oversensitivity to light, sound, touch, and taste, repetitive movements and behaviors, trouble with transition. That means the child will be rigid and does not change in day to day activities. They will have sleep problems and also difficulty in controlling their impulses. Here, one need to understand the child with autism is unique, and each child is unique in their impairment and functionality. Each child with autism affects differently in each child, and also the presentation of autism varies based upon the environment, stimulation, how the parents engage the child with autism plays a crucial role. Hence, autism is not a condition which is static, it is dynamic in nature. Hence, we need to understand each person with autism is unique and they are autistic in different ways. Person with autism are different, and many of them say it is not a disorder, it is not a illness, it is not a disease. Hence, they consider it as a neurodiverse rather than neurodevelopmental disorder. The normal people like us will be considered as neurotypical, whereas people with autism is considered as neurodiverse population, my dear friends. Now let's understand the prevalence of autism in the general population. There was an interesting systematic review with regard to prevalence of autism was published in Autism Research. It is a review article, my dear friends. It looked into the global prevalence of autism. Here, they reviewed 71 prevalence studies, and in that they came to know Male to female ratio is 4:1. The median percentage of autism case co-occurring with mental retardation is 33%, my dear friends. That is, one third of children with autism will have mental retardation. The median prevalence, as per the study, was 100 per 10,000 population, my dear friends. But however, the range varied from 1 to 436 per 10,000 population, my dear friend. The recent prevalence estimates are between 1 to 1.5%, with relative consistency across international studies were noted. Roughly, we can consider 1% as a autism spectrum disorder in general population. Similarly, there was a systematic review done in India. This included 4 prevalence studies of autism, and it included the diagnostic screening of 1,30,599 children, and it came with the prevalence of 0.09 to zero point 0.1 children between the age of 0 to 15 years, my dear friends. This was published in Neurology India, my dear friends. But at this point of time, we can understand the prevalence of autism and autistic spectrum is somewhere around 0.5 to 1% in general population. Now let's look into the comorbidities. The children with autism will have various psychiatric comorbidities. Various systematic reviews have clearly indicated 85% of the children will have one more either physical comorbidity or psychiatric comorbidity. That means out of 10, 8 of the kids will have one more psychiatric diagnosis. Let's look into them. 5 to 10% of them will have anxiety disorders, 20% of them will have depression, 10 to 15% will have sleep disorders, learning disability, OCD, intellectual disability is around 35 to 50%, ADHD, speech problem, stereotypies, epilepsy is seen in 25% of them, gastrointestinal problems, and 10 to 15% will have splinter skills or savant skills. That means here the kid will have extraordinary skills either with regard to music, art, mathematics, years, or in numbers. This diagram depicts the autism spectrum disorder, my dear friends. You can see various neurodevelopmental disorders such as ADD, ADHD, ODD, SLD, anxiety disorder, OCD, and various other disorders which are comorbidly seen in autism, my dear friends. But however, one of the important understanding about autism is we need to understand this concept of double empathy problem, which was put forwarded by Demian Milton. What did he say? In double empathy problem, the theory proposes the social and communication difficulties present in autistic people when socializing with non-autistic people are due to reciprocal lack of understanding and bidirectional lack of differences in communication style, social cognitive characteristics, and experience between both. It is not an inherently deficiency in autistic people. It is a bidirectional. That means so-called normal people or a neurotypical people cannot understand autistic. That means we also lack empathy with regard to person with autism. Similarly, the person with autism cannot understand the normal people. It is not an inherent deficiency in autistic people alone. Here, both the parties, that is, neurotypical and neurodiversity people, or else person with autism and person without autism, both cannot understand each other. That is what is called as double empathy problem, my dear friend. The idea that autistic people lack empathy is empirical, questionable, and as seen to be disputed by many researchers and scientists. And you can find many of the person with autism help other autistic kids or else various other people. They are different in this world, my dear friend. How different? Are we different? or the person with autism is a different is a big question we need to ask and answer. Here, by this diagram, I am trying to make you understand the difference between non-autistic and autistic person, my dear friend. Here, they have bidirectional difficulty in understanding. That means both the parties will have difficulty in understanding of each other's thoughts, emotions, behavior, and perceptions. That means it is bidirectional. Hence, it is called as double empathy problem, my dear friends. So, if you look at the autistic and non-autistic child, here you can see the diagram. In the autistic child, my dear friend, here you can see the environment will be bombarding with various kind of stimuli. It can be smell, sound, sight, texture, taste, and also other people's feeling. The child is unable to process this information. Hence, the child will be lost in its own world, and the child is unable to interact with human being. Whereas non-autistic child will have less of inputs, hence it is able to engage with the world. It can be able to appreciate few stimuli with regard to smell, sound, sight, texture, and taste. And further, it is able to engage with humans around him. That is the difference between autistic and non-autistic child, my dear friend. Persons with autism feels like alien in this planet because they are unable to understand the normal or neurotypical person. At the same time, we also do not understand about autism. That means we are also aliens to the person with autism. Let's understand the autism spectrum disorder. Person with autism are different. They see the world differently. They focus only on certain things, and they give attention to specific things which matters to them. They feel the world differently. They react to the sensory inputs. It may be light, sound, taste, and smell. Many a time, these sensory inputs will be heightened to them. Hence, they get disturbed with certain stimuli. They process the world differently. They think differently and process the perception and also emotions differently. They are unable to relate with the normal world, so called normal, according to me. To conclude, my dear friend, at present, autism is considered as a neurodevelopmental disorder or a condition, and it is a lifelong condition. Based upon the rehabilitation, the symptoms and impairment, they are highly dynamic and they improve further. But let me tell you, there is no cure for autism at this point of time. The prevalence of autism is somewhere around 0.5 to 1%, my dear friends. So thank you very much for giving your valuable time. Stay safe.